The unraveling of the American safety net, 4 fault lines threatening healthcare access, American healthcare at a crossroads. 4 critical challenges that could leave millions uninsured, a system under strain. The United States stands at a pivotal moment in healthcare. As 2026 unfolds, lawmakers, industry leaders, and policy experts find themselves locked in urgent debates about the future of American health insurance. While the Affordable Care Act successfully brought coverage to more Americans than ever before, this achievement masks a troubling reality for millions. Having insurance no longer means having access to affordable care. The system faces 4 interconnected crises that threaten to unravel decades of progress. The hidden crisis. When insurance isn't enough, the rise of the underinsured. Consider this troubling statistic. Nearly 1 in 4 working-age adults now carries insurance that fails to protect them financially. These are the underinsured, people whose high deductibles and out-of-pocket costs consume a dangerous portion of their income. A 2024 Commonwealth Fund study revealed that having a health plan no longer guarantees peace of mind. The consequences ripple through every aspect of people's lives. 1/3 of underinsured individuals skip recommended medical tests or treatments. Another 34% avoid seeing a doctor altogether when health problems arise, hoping problems will resolve on their own. They rarely do. Minor conditions escalate into medical emergencies. Preventive care becomes a luxury. The emergency room becomes the primary care provider. Medical debt has become its own epidemic. 29% of working-age adults carry medical debt even while insured. Families drain savings accounts, skip meals, fall behind on rent, all while trying to satisfy bills from the very system meant to protect them. The numbers tell a stark story. Family coverage premiums reached nearly $27,000 in 2025, consuming over 40% of what the typical worker earns in a year. What can be done? The most immediate threat demands immediate attention. Enhanced ACA premium tax credits, the financial lifeline keeping coverage affordable for millions, are set to expire. Experts warn this would trigger catastrophic premium hikes and send millions back into the ranks of the uninsured. Extending these subsidies represents the single most critical step policymakers can take. Beyond subsidies, broader reforms could transform affordability. Medicare's successful $2,000 cap on out-of-pocket drug costs offers a proven model that could extend to all private insurance plans. No family should face financial ruin because a loved one needs medication. Another powerful solution lies in how we pay for care. ACA plans currently pay providers significantly more than Medicare for identical services. Allowing marketplace plans to negotiate rates tied to Medicare pricing could slash premiums by as much as 25%, making coverage genuinely affordable for working families. Market instability. The house of cards, the subsidy cliff and phantom enrollees. The insurance marketplaces face structural weaknesses that threaten their very foundation. Before enhanced subsidies, Americans earning just above 400% of the poverty level received no help at all, making coverage financially impossible for many. But the subsidy cliff represents only part of the problem. Waste and fraud drain resources meant for patient care. Disturbing reports reveal phantom enrollees, people listed on insurance plans who never actually receive care, accounting for roughly 35% of enrollment in some marketplaces. Taxpayer dollars disappear into these black holes while honest consumers pay inflated premiums to compensate. Pathways to stability. One bold proposal would fundamentally reshape the insurance landscape, lowering Medicare eligibility from 65 to 55. This single change would remove the oldest, costliest patients from ACA exchanges, stabilizing premiums for younger enrollees while providing better coverage to those in the 55 to 65 age bracket who face the highest healthcare costs. Simultaneously, regulators must crack down on fraud. The Centers for Medicare and Medicaid Services has proposed stricter eligibility verification and enhanced enforcement against deceptive broker practices. Holding insurers accountable for every taxpayer dollar they receive isn't just good government. It's essential to maintaining public trust in the system. Innovative thinking could also transform how insurers approach patient health. Encouraging multi-year insurance plans would reward companies for keeping members healthy over time rather than shifting costs to the next year's coverage. Long-term health, not short-term profit, would become the business model. The transparency gap, surprise bills and hidden costs, progress and persistent problems. The No Surprises Act of 2022 represented genuine progress, protecting patients from unexpected out-of-network bills in emergency situations. Yet gaps remain like holes in a safety net. Ground ambulance services, a common source of devastating surprise bills, remain entirely unregulated. Patients can still face financial catastrophe simply by needing emergency transportation. Meanwhile, true price transparency remains elusive. Patients cannot comparison shop for healthcare when nobody can tell them what anything costs until the bill arrives. This fundamental market failure prevents competition from driving down prices and leaves consumers powerless. Closing the loopholes extending patient protections to ground ambulance services represents an obvious next step. No one should face financial ruin for calling 911 during a heart attack. Bipartisan legislation like the Lower Prices, More Transparency Act would empower patients with real cost information before receiving care, forcing providers to compete on price and quality for the first time. Perhaps most significantly, comprehensive reform of pharmacy benefit managers, the shadowy middlemen controlling drug pricing, could finally bring prescription costs under control. The PBM Price Transparency and Accountability Act would break the perverse incentive linking compensation to drug rebates, requiring these powerful intermediaries to operate in the light rather than the shadows. The Medicaid time bomb looming, coverage losses. The greatest threat to American healthcare coverage may be the one receiving the least attention. The proposed One Big Beautiful Bill Act would slash federal Medicaid spending by approximately $1 trillion over the next decade, combined with expiring ACA subsidies. Analysts project that nearly 15 million Americans could lose their insurance entirely in the coming years. The consequences would cascade through every corner of the healthcare system. Uninsured patients delay care until conditions become emergencies. Emergency rooms, the most expensive care setting, become the default provider for preventable conditions.